Hello and welcome to the latest Q&A with Asthma UK and the British Lung Foundation's in-house GP, Dr. Andy. In this episode, Dr. Andy will be providing some guidance on what to do if you're having trouble getting the support you need to manage your lung condition. Plus, he'll be giving you some tips for looking after your mental health. And stay tuned to hear from one of our lovely helpline nurses who will be sharing some expert advice on how to manage seasonal triggers in autumn. If you need any information about anything discussed today, you'll find lots of useful links in the description below. And if this video helps you, please do let us know by giving us a like, leaving your comments, or subscribing to our channel today. And if you feel able to, please do consider making a small donation today to help us continue defending the nation's lungs. Hi Andy. So we're currently getting a few calls to our helpline from parents who are worried about their child's breathing problems. Do you have any advice for parents who are going through that, especially if they're having trouble getting an appointment with their GP?
First thing to say is seeing a child who's struggling with breathing or coughing or any other chest symptom, it is very worrying. And I remember when my boys were younger, you realise that you're fully responsible. You don't always know what the cause of their symptoms is, and you can't measure how serious it is. And you also don't always know what to do when things are getting worse. So with respiratory symptoms, there are lots of different symptoms and lots of different causes. And there are viruses, there's croup, there's bronchiolitis, there's whooping cough, and asthma as well. And they can all cause different versions of coughing, wheezing, breathing difficulty, and mucus and phlegm as well. And although on here I probably won't go into as much detail as some might want, because what I don't want to do is give people the wrong information so they're falsely confident so they don't seek the help they need. But what I will do is highlight the sort of things that when I speak to somebody on the phone in the surgery, or for people who speak to our wonderful helpline nurses, the sorts of things that we look out for so that we know that they are safe. They can maybe call 999 if they really need to. So the sort of things we really worry about is if you think your child is struggling to breathe, or if they're breathing so hard they're starting to get tired and exhausted with it. If you find they're using lots of extra muscles to try and breathe, so that might be the ones in the neck, it might be the tummy muscles, and those muscles under the ribs sucking in. You might hear your child grunting. That's also a very worrying sign. And children who are breathing very, very fast. So children do breathe faster than adults. If they're breathing much faster than normal and look like they're putting in too much effort, then it's definitely worth getting somebody to check them out as an emergency. The other sorts of things we really worry about are things that you might not directly tell us about. So if they're a bit more tired or drowsy, if you're unable to wake them completely, and also things that signs like dehydration, so if they're not passing urine or having wet nappies if they're younger. Going back a step from that, so if you're ever worried about your child's breathing or their cough or their chest, definitely worth speaking to somebody with some clinical training. The sort of things you should definitely speak to a doctor about is if they've had a fever for more than 24 hours and there's no other obvious cause as to why that's happening. If they're having problems eating and drinking, or as I said earlier, like the signs of dehydration, like they're not passing urine regularly or having wet nappies. And if they've had a cough more than a few weeks, it's definitely worth getting them checked out because there could be something underlying that needs checking out. And if they have got asthma or another lung condition and they're more short of breath or their symptoms are worse than normal, again, make sure you're getting somebody to give you some advice and hopefully check them out as well. So if any of those worrying signs are happening that I said before, never worry about calling 999. They'll talk to you on the phone, they'll work out what's going on, and they can redirect you somewhere else if it's more appropriate. For other situations, definitely call your GP surgery first. They're the people who probably know your child and your family best, and they can assess you and get you seen hopefully sooner rather than later. But if they're too busy or they're shut because it's the weekend, for example, then call 111. 111 can usually help to find you an appointment or at least give you some advice and check things out over the phone for you. So if the GP surgery is busy, contact 111 and then that can hopefully get you the help that you and your child need. And if your child isn't unwell and you're just wanting some advice about chest symptoms generally, as I said, we do have our helpline there as well. So give us a call for a chat, but they will help you to get the care that you need if there's something else going on as well. So hopefully that's answered your question, Rebecca, and will give some people some ideas of the sort of things they can do if their child's getting chest problems.
Oh, that's great. Thank you, Andy. And when you see people in your clinic or speak to them on the phone and they want to know more about their lung condition, where do you send them for more information?
Well, something I've learnt over the years is that you can give people too much information. There is so much that you can teach them about asthma, COPD, other lung problems, but actually people only tend to remember three things at a time, and I never presume that they can take in more. So I do tend to write down a lot of things when I see them, or even better, I'll tend to write it having seen my writing. Because of the limited amount of time I get in clinic or on the phone with people, I almost always try and follow them up to give them information in different stages. And something I pretty much every time do is direct them to the Asthma UK and British Lung Foundation websites. They're both absolutely brilliant. They cover exactly what you really need to know. It's written in a way that's really easy to understand, and there's a really good mixture of videos, reading, and the experiences of other people who've got that problem as well. So it's a really good way of helping people to find the type of information they need and in a way that they'll sort of picking up easier. The things that aren't covered on our website, then I find the NHS website is very good and improving all the time. There are lots of things on there, again, written in the right way so people can understand it, and so definitely worth having a look on there. I recently sent a family member there who wasn't even aware the NHS had a website, and they were amazed at some of the things they learned from it. Other things that people can do to pick up information, that there is our helpline. So if you've spoken to your GP or nurse and there's lots of gaps, you don't understand what's going on, then our helpline can often just help you fill in those gaps and give you some more information. People with long-term lung conditions, there's our Breathe Easy groups all around the country, and there you can access not just people who are in a similar situation to you, but also so that they get experts in to speak and they've got contacts who can help fill in with more information. People with long-term lung conditions as well might benefit from something called pulmonary rehabilitation, and definitely worth having a look at our website for what that's about. And as well as helping people to live with their lung condition better, there is an education component as well. So there's some really good information coming from experts with a bit more time, and they can personalize it to you to really help you move forward and understand what's going on. And something I've started doing more and more these days is there's a lot of things online, and we've got a forum called Health Unlocked, and people with lung conditions can go on there, and our nurses and other clinical experts are on there as well, and that can help to fill in people's experiences and more information just to help them move forward. Twitter and Facebook as well. There's really good community on there. Both Asthma UK and British Lung Foundation are always just putting little bits on there to remind you about what your conditions are, what you can do to look after them, and also hints and tips about what's coming up. So whether we know there's a particular trigger or a drug shortage happening, lots of information on there that will drip into, I suppose, into your consciousness and your life. So you can pick up more every single day from them. So there's so many different places, Rebecca, where people can go. So if they're struggling to get all their answers from their GP or their nurse or their consultant, then loads of ideas there. And what I'll do is I'll get you to put up a load of links on this webinar so people can find out where they can go as well.
Great, and I'd just like to say that all our advice is, of course, correct at the time of filming. And if you want the latest updates from Asthma UK and the British Lung Foundation, either about vaccine updates or any of our other information, please do check out the links in the description below. And if you're finding this video helpful, please do comment or like the video or subscribe to our channel today.
Hi, I'm Andy. I have a lung condition and I work at Asthma UK and British Lung Foundation. Thank you so much for considering a small donation. It would mean so much.
Thanks, Andy. So for our next question, we're going to hear from Caroline, who works on our brilliant helpline. Lots of people think of summer as a time when seasonal triggers affect their lung condition. However, autumn can also be a troublesome time for triggers and allergies. So could you talk us through what some of these autumn triggers might be and what people with asthma and other lung conditions could do?
That's a really good question, because we get lots and lots of inquiries on our helpline around autumn about this very thing. And not only are we being exposed to more colds, coughs, viruses as we're getting out and about a bit more, but there's also the change in temperature that can trigger There are mold spores around because the autumn weather, there's lots of wet leaves on the ground outside. That can trigger a reaction, as can mold spores indoors if there's any damp in the house. And as well as that, we've all got our heating on, so wood burners can be a trigger for some people. And the increase in house dust mite in the homes because of the central heating can be a real problem. So there are lots and lots of triggers to be considered. And we often speak to people who have stopped antihistamines because their hay fever season is over, but they're forgetting that they could be allergic to these other triggers. And if they've got any nasal symptoms, any congestion, itchy runny nose, or postnasal mucus, that can trigger asthma further. So really important to get these things treated. And you could speak to your doctor or asthma nurse for a review, and they may consider sort of antihistamines throughout the season, as well as possibly a nasal steroid spray. Really important to keep taking your regular preventers, but some adjustments could be made to that as well. So as I say, really important to get a review, make sure your action plan is up to date. We've also got a brilliant triggers page on our website, so do take a look at that. It takes you through all possible triggers, and it may well help you to manage things better through the autumn and winter months. And please call one of our nurses on the helpline if you'd like to talk things through, or use our WhatsApp service.
Thanks, Caroline. That's really helpful. Now, living with a lung condition or supporting someone with a lung condition can be really tough. So what advice could you give people around mental health and well-being?
Yeah, that's one that comes up very regularly, and more recently, I think we're seeing a lot of people who are more aware of their mental health. Mental health can affect all of us, and it can range from very mild, so we might just feel a bit more on edge, a bit tense, or a bit sad, to much more severe with a more full-blown depression or panic attacks or severe anxiety. And they also impact people in different ways for different people. And I find that some people are better at hiding it than others, and that can bring its own problems if people aren't dealing with it sooner rather than later. So having a long-term condition, a respiratory condition, or even persistent symptoms can have an impact on mental health. Your symptoms might get you down, they might make you more self-conscious, they may stop you doing things that you like doing or stop family members doing things. They can impact on your sleep and make that more difficult so you don't feel as rested. They can be unpredictable, so you can't plan ahead very well and you haven't got things to look forward to in the same way. You may find that you need to be relying on treatment and you don't like that, or the treatment itself is a bit of a burden to you. And really importantly, you might feel guilty that you're needing to rely on other people and you're impacting on their lives. So I see lots of different negative symptoms from people who have a lung condition or are impacted by a long-term condition, such as being guilty, being isolated, feeling lonely, feeling tired, feeling worn down. And it's really important to acknowledge that they're there, and to look at things that you can do to try and combat them. We can't always take away people's lung conditions or their lung symptoms, but we can help people to live with it. And I spend a lot of time giving people hints and tips so that they're not brought down so much by their symptoms. So firstly, I get people to try and take some very positive steps, and definitely worth having a visit to our website. We've got some good mental health pages on there and some good tips on how you can help yourself and where you can get other help as well. So in terms of the basic things that you can do, make sure you're sleeping well, getting enough rest, and you're eating and drinking well. Try and avoid getting into negative habits. So try and avoid too much alcohol, too much caffeine, smoking, eating the wrong things. Try and keep active. We know that exercise and activity can help people not just feel better, but it changes their situation. It helps them to get out, and it can sort of give you what we call endorphins, which give people a positive feeling in their brain and help people feel better. We know that's a very good way of helping to combat depression as well. Try and find things you enjoy. And if your lung condition means you can't do those normal things, find some new hobbies that you do enjoy, even if that is sitting in front of a box set or spending time with friends or doing something different outdoors. It's really important that we connect. So telling other people how we're feeling. Those around you need to know that you're feeling guilty, whether you're feeling low or lonely or isolated, And even though you might feel guilty that you're telling them and being a bit of a burden, it's really important to get it off your chest because they can do some little things to make it feel better for you. I think I talked about this earlier. We've also got our Breathe Easy groups, we've got online forums, and of course you can try and talk to your healthcare professionals. They might be able to look at different treatments you can access. They can look at counselling, they can look at psychological therapies, or they can even just give you some understanding and try and find things that can further help your lung condition or minimise the impact of the condition and the treatments on your life. And as well as that, I mean, we've just heard from Caroline, we've got our excellent helpline nurses. They are used to talking to people who've got lung conditions, they know exactly what it's like to be struggling, and they can find little hints and tips to help you move forward, even if it is just listening to you as well. I know we're sharing lots of our links today, but definitely have a look at our breathlessness page. We've got some really good exercises on there to help people control their breathing, because when people are depressed or anxious, we find that the breathing helps to control them, but actually you can do more to sort of turn that round. There's lots of hints and tips about relaxation and mindfulness, and I know previously we've shared videos and webinars about people where this can help. So there's so much out there that you can do that is positive. But if I had to give one tip, or actually those are two tips: do the basics, so sleeping, eating, drinking, activity, and then make sure that you're sharing with other people. It's other people that will help you get through this. So really make sure that you're sharing how you're feeling.
That's fab. Thank you, Dr. Andy. Thank you so much for watching today's Q&A with Dr. Andy, brought to you by Asthma UK and the British Lung Foundation. If you found what we've been discussing today useful, please do like the video, comment and subscribe to our channel today. As mentioned, you can find lots of useful links in the description. And please remember, if you feel able to and you find our health advice helpful, please do consider making a small donation today to help us continue defending the nation's lungs.